Hello guys, welcome to my channel. This is the Nelson Group, and in this channel we will be talking about Osce. What is Osce? Osce is just like a practical test which comprises of different stations. For now, it's all about 10 stations we have in this Osce, and Osce is all about UK exam for nurses. All right, so today we are going to discuss about nutrition assessment. In nutrition assessment, we have different charts, but don't be discouraged because in this chart is very simple. Believe me, this is one of the easiest station, but to be sincere with you, you have to open your eyes. You have to be careful because they will try every means they can to do what? To manipulate you, to test you, because that is all about the test. So today we're going to talk about nutrition assessment. This is how it looks like. All right. Now let me show you the chart you familiarize yourself with. We also have these charts. You can see the one on the screen. I'm putting it on the screen. Okay, and also you have another this, which is more of the stage 2 of the chart. Okay, and the last one is this. You can see we have step 1, step 2, and step 3. Now let's go in full details about this nutrition assessment. In nutrition assessment, it can also call MOX, which means malnutrition universal screening tools. Okay, malnutrition universal screening tools. All right, in this video we're gonna formulate our own scenario, and scenario I'm going to form with you today is this. Listen, and you can see it on the screen appearing right now. It say Mr. Potter Ash is a 78 years old man who is very frail due to his age, and he had a heart failure. His height is 1.4 meter and his weight is 68 kg. He has lost around 10% of his body weight in the last 2 months, and he has not been unwell. This is the scenario, and if you didn't look very well, you will feel like, oh, this is a simple question. Yes, it is very simple, but then you have to be careful. Sometimes, let me also tell you about the secret. And this secret, when you watch the fourth step, because this come in step 1, step 2, step 3, and the step 4. I will tell you why this secret. Under the wash out on the step 4, you will understand this secret. Now, from this scenario, what you will do is quickly go on with the step 1. What is the step 1? Step 1 is to get the BMI, body mass index. And how do you get the body mass index? What you will do first is go to the chart. The chart you are seeing on the screen, this one. You check on the chart. What is the age? What is the age of this person? What is the height? And what is the weight? But on the chart, what you will do is the weight and the height. This is what you will use to get the body mass index. Let's go straight now. And when you're checking, the scenario says he is 64 kg. He weighs 68 kg. Weighs 68 kg, and his height is 1.64. So this is his weight, 68 kg. All right. You use your ruler to check on the charts. You see here by this side, you will get the weight. When you see the weight, you trace it down. Okay. When you trace it down against the height, here it says 1.64. So 1.64, what I can get here is 25, which is 0. Now we have gotten the BMI of this patient. Step 1, he scored 0. Okay, if you are able to get this, you now move to step 2. What is step 2? Step 2 is for you to do what? For you to use the weight loss. Now, under the weight loss, it stated unplanned weight loss in the past 3 to 6 months. Remember, what we say here is that if there is unplanned weight loss in the last 2 months, it's not among this particular, it doesn't fall within this. So now our patients lost only 10%. So where will you get, what is the score for this 10%? When you come under the step 2, you will see here that it is written here. You see, look at your screen. It says unplanned weight loss in the past 3 to 6 months. Here is the percentage and here is the score. They say less than 5%, that means 0. If he lost 5 to 10% of the body weight, he scores 1. And if he lost more than 10%, which makes him to score 2. Now, for this particular patient, he scores 1 because he lost around 10%. And another way for you to also get this is using this chart. You can see it, this chart, you can see it on your screen right now. And it says step 2, weight loss score. If the patient lost less than 5%, okay, that is the green part of it is less than 5%. The yellow part of it is between 5 to 10%, where our answer for this scenario falls, which is 1. Then on the red side, right hand side, is the red color, which makes the patient to score 2. So if they said that patient lost more than 10%, remember, if the patient lost more than 10%, this automatically now make him to be scoring 2. Okay, and now these patients have also scored 1, which from the scenario it says around 10%. Okay, so you write out 1 on your answer. You move on to the next step. The next step says acute disease. Acute disease affect the score of this. If patient is acutely ill and there has been or is likely to be no nutritional intake for more than 5 days, automatically he scores 2. This is the secret, guys. If they twist it, make sure they might give you that the patients have had some food in the past 5 days. Remember, the question says the patient has been unwell, has not been unwell, I'm sorry, the patient has not been unwell, which means he is a healthy patient, which give us a score of 0. Now, there are arguments. Some people are saying these patients have scored, this patient supposed to score 2, or this patient supposed to score this. Follow what is being given on your scenario and what is on the guideline. This is the NMC guidelines. Okay, so if the patient is acutely ill and there has been or is likely to be no nutritional intake for more than 5 days, automatically scoring 2. But if not, he's scoring 1. So for this purpose, for this particular video and this scenario, this patient have scored 0. Now we move on to the next step, which says step 4. On step 4, what you will do is you calculate what you get on this step 1, step 2, and step 3 together. The answer will be the step 4. Okay, so on this we can see is only 1. The patient is scoring 1 on this. Now we move into step 5. Step 5 is where you will do what? Where you will check your final score on this. This is where you will check where the patient belongs to. Now, the important question for you to know on this step 5, remember this station is both silent station and verbal station. What I mean is combination of the two. They will give you time to write. After you have write, you explain what you have done to the patient, that is their assessor. Now on this, what you will do is you start with explaining all the steps. For me, if you ask me to now do this station, what I will do now, I will say, Mr. Porter, on my assessments, you scored 0 on step 1, and you scored 1 on step 2, and you also scored 0 on step 3. And because you scored 1 on step 2, calculating all the scores you have scored already, I'm able to get 1 in step 4. And this now led me to do my final step, which is step 5. And under that step 5, you scored 1. Now, using the management guide, you now start reading this, guys. This is the management guide. You can see it on your screen. You use this management guide, now start reading to them. On this, you are medium risk, okay, obese. Now, what are the guidelines for you to read out for this patient? What you're going to read now is that I will document dietary intake for 3 days. If adequate, little consign and repeat screening. Then if it is in the hospital, I will monitor you weekly. Then if it's in the care home, at least monthly. If it's in the community, at least every 2 to 3 months. If inadequate, clinical consign, following local policy, set goals, improve and increase overall nutrition intake, monitor, review care plan regularly. Then you also now mention this particular one. Don't forget this one here, guys. Remember, this particular guideline will be given to you on that day, and this chart will also be given to you, so don't panic. Okay, it's one of the simplest station. What you will do now, when you read out all this, you now say, I will also treat underlying condition and provide help and advice on food choice, eating and drinking when necessary, record malnutritional risk category, and also record need for special diet and follow local policy. Don't forget, you also tell the patient that, you tell your assessor that you will do what? You will encourage the patient to do what? Eat more. Advise the patient on nutritional intake, okay? You also do what? give the patient time to eat the food that have been served. You also involve the patient in his own care plan by doing what? By allowing him or her to make choice and correct him to the right food he's going to eat and give him time. Okay. Also tell the family member to encourage the patient to do what? To eat. By so doing, you will tell the assessor, I have finished this session. Make sure you record and sign everything you have done. This is the simplest station, guys. So with this, I believe you're scoring your pass mark and you're getting it. So guys, a lot of people have done this station, but because of the tricky questions, let me now show you the tricky question. You see where they give you 1.64 kg, that they may do it in terms of 1.61 or 1.63. You know what I'm saying? When you look at this, I'm bringing it again on your screen. When you look at this under here, they put it in terms of 2, 4, 6, 8, 10. There is no even numbers. Okay, so if you get anything like 3, 5, 3, 5, 9, you have to use your number 6 to know that this is in between. This is where the answer should go. Guys, if you find this video interesting, please give us a thumbs up, like and share this video. In the next video, I'm going to drop a marking scale, the marking scale for this particular station. So guys, watch out for the next station. If you haven't subscribed for my video, please subscribe for our video. See you in the next video. Thank you so much and remain blessed. Bye.